amid the surge in COVID cases in China, fresh fears triggered over BF.7 variant. Should India be worried? What does India need to do? We will decode the new Omicron sub-variant for you.
We are decoding BF.7, the sub-lineage of Omicron, which is wreaking havoc in China. So this essentially is the sub-lineage of Omicron, BA.5. Symptoms are similar as other Omicron variants. In that sense, nothing has changed. BA.7 carries mutation R3460, that aids escape antibodies. Omicron, remember, has mutated over 500 times in 1 year. Strongest infection ability of BA.7 is the reason why the infection rate is so high. That is the reason why so many people are getting sick. The reproductive value of more than 10, it actually is hovering around 10 to 18, which means one infected patient can infect up to 10 and more. Higher immune escape, shorter incubation period is what makes it so problematic. Higher transmission rate, like we mentioned. It's known to cause serious illnesses in those with weak immunity, and that's the reason why so many people, especially the vulnerable in China, are dying. Now, it's not just been seen in China. It has already been seen in many other countries, including in India. It was seen in India as early as September this year. It's also been seen in the UK, in US, Belgium, Germany, and Denmark.
My colleague Nabila Jamal spoke to Dr. Louise Blair, head of vaccines and epidemiology, on the surge in COVID cases. Listen.
Dr. Louise Blair, head of vaccines and epidemiology at Airfinity, a health data and analytics company. Dr. Louise, thank you very much. We want to understand from you the scare, the COVID-19 scare that we have yet again 3 years on. China is really exploding. Their health infrastructure maxed out. US is fearing a surge in their country. India is, of course, currently preparing itself. Tell us, should we be worried?
Well, I think what we're seeing in China is a real increase in cases. They've dropped their zero COVID policy, and following which we're seeing a real surge. And these cases aren't being officially recorded, but what we are seeing is indications in media reports that hospitals are being overwhelmed, and also that there's a significant number of deaths. Now, as always with a large surge in cases, there's always concerns over a new variant emerging from the region as well. So countries such as India are preparing in case any new variants reach their shores.
You know, Dr. Louise, what's your take on herd immunity? I know UK tested it at one point, even though China wasn't really willing to practice herd immunity. It appears now with your health infrastructure maxed out, they have no other choice but to try herd immunity.
In terms of the rate of cases that is occurring in China, from what we can get from indications from media reports, it may be really too late at the moment to ramp up vaccinations in order to significantly make an impact. We know China has been very successful in order to ramp up vaccinations within the country. We've seen a peak of 22 million vaccinations a day, but unfortunately we think that that's too late now, and by the time that they could reach that level of vaccination, the cases may have already at least had one peak within the country. So in terms of measures that China could implement to help slow the impact, it would really be other measures such as, again, going into lockdown, restricting movement and mixing in order to control that number of cases at the moment. Now, of course, with a significant number of people being infected, there will be individuals getting protection and natural immunity. However, there will be the most vulnerable still getting severe disease and risk of death. So while a large majority of the population could get protection via herd immunity, unfortunately it would mean there would be a significant number of deaths in the meantime.
Right. Dr. Louise, a quick word on, since you mentioned vaccines, of course, India has really ramped up its vaccination drive, and we've really achieved it successfully, are booster shots. Would you give any kind of importance and prominence to a booster at this point in time with the new variant?
Well, we have seen with boosters that it can raise protection within a population. Unfortunately, with the vaccines, over time, the protection does wane, and therefore, in order to really ensure protection levels within a population remains high, boosters can offer that protection and achieve that.
Right. Dr. Lewis, would you have a word on the new variant that's really driving the surge in China right now, the BF.7? It appears there are 4 cases that have been detected in India also. What kind of symptoms do we expect? Any different from the first few variants that came up?
Well, with variants, unfortunately, there's limited data coming out from China. So while it is suspected there may be BF.7 circulating, there could also be other Omicron subvariants. Now, within a protected population, within countries that have achieved high levels of vaccination, we have seen Omicron and Omicron subvariants appear more mild, sort of fewer people getting severe disease. But of course, in China, the levels of vaccination, particularly boosters, and the individuals have had significant time since they've had a booster dose. That may be different within that population as well, so more severe disease still occurring with this Omicron subvariants.